Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome back, everybody, to another episode of Keiser Voices, and we are continuing our conversation on mental health. And we're so excited to finish out our conversations with a series of special episodes for you featuring our fabulous faculty from our clinical mental health program. So, starting off the conversation about feeling overwhelmed and how the brain handles stress, what to do, are Dr. Victoria Panna from our clinical mental health program, who's going to tell you a little bit about her background and specialty here in a moment. We have Dr. Briana Kemp, and we also have Dr. Shama Panjwani. So, Dr. Panna, before we start, can you tell us a little bit about your background in the clinical mental health?
Absolutely. So as a full-time faculty member, I have the honor of being the resident sexologist on staff. So a lot of my background and expertise is in sexual-related concerns, sexuality-related concerns, and navigating relationships. And my main area of expertise is in navigating body image and self-esteem in self and in relationships after significant weight loss using weight loss surgery and GLP-1s.
Thank you. Dr. Panjwani.
All right. Thank you for that, Heather. I am Dr. Shama Panjwani. I've been with Keiser for about 4 years. As far as my clinical background, I focus a lot on different types of traumas, particularly immigration trauma, attachment trauma, intergenerational trauma, cultural and racial trauma, as well as mindfulness and holistic wellness, and utilizing polyvagal systems theory to kind of work with resetting the neuroplasticity and the nervous system to be able to regulate emotionally.
Thank you. And Dr. Kemp?
Hi, I am Dr. Kemp. This is my second year at Keiser. And as far as clinical background or clinical, expertise, I would say a lot of my work is surrounded around people that are going through different transitions, life transitions, adjustment transitions, and just really adjusting to these new stages in their life. I would say population that I'm really interested in working with or have a lot of history in working with are our BIPOC community, really working with those that are, described as being minorities or marginalized individuals, and their experiences with any type of discrimination or oppression, and really kind of helping them work and navigate these systems that were created to kind of keep them down, or keep them at the lower end of society. So really working through those things.
So I'm just going to throw it out in the world. I want a follow-up with all three of you because I would really like to deep dive into what these areas of specialties that you have really cover. I think that would be a fabulous future conversation. But for today, I'm going to keep myself under control and try to keep to just the topic. So I guess, Dr. Kemp, if you don't mind starting us off, when we talk about feeling overwhelmed, can we define that? Like, what would we define overwhelm? Is it just like too much going on in our lives, or is there a better definition for that?
Yeah, when we talk about feeling overwhelmed, I always like to ask the individual to define it, to really understand what it means to them. A lot of times people share physical, visceral, somatic symptoms that they may be experiencing, severe headaches, loss of appetite, unable to sleep, or get some type of rest. And then a lot of times as we're processing that, we get to an understanding that it really is impeding on their daily functioning. And so I think that is a big symptom of feeling overwhelmed, recognizing that the things that you could easily do, you're no longer able to do, or maybe finding loss of interest in doing those things, or recognizing that it is severely draining you to do these everyday functioning things. So again, it really does depend on how the individual is defining it. But a lot of times those symptomologies that I just shared often kind of equate to what it means to feel very overwhelmed.
Dr. Panjwani, are there external or physical attributes that come to being overwhelmed, Because it sounds stressful, right? Is it just another way of saying stressful? And then does that have an impact on your body?
So I think Dr. Kemp did a good job kind of starting us off in that direction as far as how it shows up physiologically for individuals. So I do think that anything that's happening in your mind is also happening for your body in many ways. So there are some external physiological things that you would notice in your body when you are feeling overwhelmed. And yes, stress is one way to look at it. Anxiety is another way to look at it. Everyone's going to define it differently. Every person is different. So when we think about it from a physiological perspective or how it shows up in your body, it could show up as fatigue. It could show up as maybe you've been having a medical condition that shows up all of a sudden in your body, whether it's gut related issues. Usually it's that it starts off there. It could be headaches, migraines, muscle tension. All of those things are part of the signs and symptoms of feeling overwhelmed. And that mind body connection really shows up when our body is taking on a lot because our mind is going through a lot. And sometimes what happens is we recognize the body symptoms prior to recognizing that our mind is actually as stressed as it is.
Dr. Panna, Dr. Panna, when we look at this, at what's happening in the brain that's been shared already by Dr. Panjwani and Dr. Kemp, we often feel as individuals like it's uncontrollable. Where does that stem from?
So I can go into two directions, and I guess I'll briefly kind of cover both of them. So it's a chemical response as well as a learned response. So the chemical response is where our brain, once it starts to recognize that there is overwhelm or that there is stress or anxiety, it shifts into a survival mode. And when we go into survival mode, the main player in that is the amygdala. It acts like the brain's alarm system. So when the alarm system starts to sound off, the first thing that we do is scan our environment. We want to scan for danger, for threats, for problems, anything that could be attributing to stress, anxiety, overwhelm. Something might be off. It could be based off of a conflict or rejection or nervousness, overwhelm, right? And it often will respond to something that is really happening or just, hey, something similar has happened before. And so we're just kind of preparing ourselves. So once the alarm has been sounded off, then we find that our body starts to release chemicals like cortisol and adrenaline. And when cortisol and adrenaline are released, cortisol is responsible for letting us know that there's something overwhelming or stressful, and adrenaline helps us to prepare to deal with that overwhelm. That's when a lot of the physical sensations can come into play and can come, as Dr. Panjwani and Dr. Kemp had both discussed. It can have, our heart races. We can find that we become shaky. We may even start to experience breathing changes, but we are now hyper alert. So then we have the prefrontal cortex that comes into play. And the prefrontal cortex is the part of our brain that's responsible for logic and is responsible for thinking and emotional regulation, even decision making. That goes offline. So once that now is offline, we then find that we go into the mode around I'm overwhelmed, I can't think clearly. I know that there's something here, I'm overreacting, right? We start to have those types of responses that can come into play. And the positive news is that we can work through it. I'm sure we'll get to that in a minute. The learned response part of it, that second piece of it, is that for some people, when we have these responses that come up in our body that are physical, we have already become conditioned to cope with it in certain ways. So we go back to what is comfortable and familiar, not necessarily logical or doesn't necessarily make sense.
So you said two things. I mean, you said a lot of things, but there are two things that truly stood out to me. And I want to piggyback off one of the things that you said, because I was actually, honestly, I was thinking about that when we talked about uncontrollable. It's, well, you're overreacting, right? That comment that you get sometimes is you're overreacting. And obviously, based on everything that you guys have shared so far and just from your experiences, that's not necessarily an overreaction. That's how that person is interpreting their stress. That's how that person is interpreting their feelings of overwhelmness. Are there other common misconceptions that we should be aware of to just better educate people? And I don't know, Dr. Pan, if you want to keep going or if somebody else wanted to pick up from there.
I mean, I can, unless Dr. Kemp or Dr. Panjwani has something that they'd love to add.
How about you start and then I'll add?
I think one of the biggest ones that I find in my clinical work, and even if I had to think about it, even with some of the students that I interface with, it's checking a lot. Like I'm double checking, I'm triple checking. I just want to make sure. I'm maybe trying to complete a task, and I'm not necessarily able to really grasp all the directions, or I know what I should be doing, but I don't feel comfortable or settled enough to be able to, complete the task. I might logically know something, but I just need the reassurance or the validation that says, yes, I'm in the right direction. I find that happens a lot with some of the people that I interface with.
What I would add to that is there's a mental fog that also takes place sometimes, the mental fatigue, where because there's so much going on, you're not able to fully be present with any of it. And it has happened with my students and clients where they might have a lot on their plate and they're not able to really navigate any of it because now they feel almost this paralysis. They feel stuck because they don't know how to come out of the stuckness. Now nothing is really being done. So that is a common response that also takes place. Something else Dr. Panna mentioned was it reminded me of grounding. People who are overwhelmed are not grounded enough to think clearly. So that's where the logical brain is also impacted. And because they're not grounded, their emotional regulation is also off. And so their reactivity is going to be higher. And that doesn't necessarily mean that that's how they want to respond in that situation. It just means that because they're not able to regulate, they're not grounded, that's what's coming to them more naturally, even if that's not their natural self.
So then, Dr. Kemp, I guess my question is, are there recognizable early signs that stress is about to overtake you or the overwhelmingness is about to overtake you that someone can pay attention to, to prevent from hitting that overwhelm stage? Like, is that preventative, if you will?
Yeah, so I think a lot of times when people are, coming in for some type of clinical intervention or acknowledging that they're stressed and overwhelmed, sometimes it's because they've kind of reached that peak of like maybe having those physiological responses. And then like Dr. Panjwani was saying, they're not at their baseline. So maybe I'm being more irritable or I'm being snarky, in my communication, my interpersonal relationships. So I think having that acknowledgement is fine. And then after they're kind of processed that, they're then able to catch it, prior to it happen. But a lot of times it's like an after effect type thing. I think the body is a big sign. There's a book that we always talk about in our profession, The Body Keeps the Score, when a lot of times your body will tell you first because sometimes you aren't able to catch it. So it could be something like on a smaller scale of just like, oh, I'm feeling really lethargic lately, or like maybe something mid scale of like I'm losing my appetite or I'm overeating, and then something more large scale like I'm breaking out in hives and rashes, and being able to now connect, oh, my body is trying to tell me something, and then, trying to get into those interventions, those grounding techniques and things of that nature. Another thing we like to say is just like staying ready so you don't have to get ready. So being more intentional moving forward about like self-care, having healthy boundaries, being able to assert your communication when you feel like you need to take a beat or take a moment away from a situation. So sometimes you have to get to that pinnacle and learn those skills and then be able to implement them more regularly so that you won't get to that pinnacle anymore.
Dr. Panna, I think it's important to also point out, like we're talking about preemptive signs. We're talking about what the signs are when we've hit that stress stage, when we've hit that overwhelm stage. When we look at long-term or chronic stress, how does that affect your decision making, your relationships, just your overall well-being if you're not managing it?
I think a lot of those things have already been highlighted in our conversation. It really becomes, it can be not only cognitive or thought related, but it can also be physical. So when we think about the long-term effects of stress, it can have really damaging effects to major organs. It can have damaging effects to gastrointestinal systems, or the gastrointestinal system and other related symptoms. It can cause us to have sleep related issues where we now have trouble falling asleep, staying asleep, maintaining a sleep schedule, waking up not feeling rested. As Dr. Kemp had mentioned, it could have issues with overeating or not eating enough, which can then spiral into other related concerns. So, from a physical aspect, it can be sort of the catalyst for snowballed physical responses that our body may have that longer term might need interventions from more providers and medical doctors. From a thought or cognitive perspective, it can cause issues not only with decision making, but also with focus and concentration, with retaining information, recalling information. With many people that I work with in my specific niche, I see a lot of times where they feel like their self concept, the belief they have about themselves, their body image, their self esteem, their sexual self esteem, it is depleted, if not in the toilet. They struggle with being able to feel, okay with themselves. Many times there's comparisons, the person I used to be versus the person I am now. There may be, some people will respond where they are so shut down that they may become almost avoidant in going to places or seeing people or doing things that they once enjoyed. We may also find that they may become so withdrawn from just the things that they, are trying to enjoy in their life, or being able to try to find balance, that they now lack boundaries. They lack the capability of maintaining themselves. So I think when we look at it from a more acute to a chronic, or a short-term to a long-term basis, the sooner that we can find it, find out what the stressors are and where the overwhelm is and how to manage these things, I think longer term it can help people to feel their best.
I want to add to that too, because along with the physical and the psychological, there's also the social aspect. I know we kind of touched on it, but when there is chronic stress involved, then we are also dealing with individuals who may be struggling with maintaining relationships or having healthy relationships because of the irritability or because of the reactiveness, where they might be burning bridges and aren't able to respond in a way that's positive or healthy or effective in terms of their communication.
So then I guess my question for you then, following up with that, is we often see very easily with the veteran population that asking for help is hard. And sometimes people don't, and not just our veterans, right? A lot of people struggle with knowing when and where to ask for help, or even to ask for help, period. But you have a lot of individuals, again, for various reasons, that it's not that bad. I'm handling it. I'll figure it out. It'll work itself out. Like, it'll go away. It's temporary. How do you help them? I guess how do you lead the horse to water and have the horse drink the water when it's thirsty? I guess is my question. How do you encourage them to realize this is a concern and it needs to be addressed?
So when you think about individuals who have that kind of mindset, it goes back to what Dr. Panna was saying, the learned behavior. This is hyper independence. These are individuals who have developed this type of thinking because either they did not have the help that at the time that they needed it, or they haven't had people around them that are reliable, or systems around them that are reliable. So, or they're just not able to recognize because of the lack of awareness, kind of going back to what Dr. Kemp said, as far as people don't come until things have reached a peak point of stress, because our society has set up things in a way where we are taught to keep pushing, keep going. We have to keep going. We don't have the option to take a pause or rest. A rest is also something that's looked at as negative. So first, that's the stigma that a lot of people are carrying. That's the mindset a lot of people are carrying. And that's something we have to educate people on, is that, hey, that's not normal. That's not what is expected of humans. It's not realistic. And then once we have that understanding, the awareness is also important, is recognizing that you don't have to push. You do have resources available, and this is what it looks like. I think it's also helping them recognize that what they're experiencing, they're not alone in that. And normalizing it is also important, because we want to make sure that they recognize that it's okay to ask for help and they're not alone, and it does not make them weak. And this is the structure that's set up by the systems that we live in and are surrounded by. And once we educate them on that, I think it also helps to say, hey, you're not, I'm here with you. Here are some resources. Let's put you towards a better way of living, a better quality of life, because if you keep continuing in this path, it's going to be detrimental. And here are the reasons why that's going to be detrimental and what that could look like. So let's pause here and talk about ways that we can improve your way of living, improve your stress, and your coping mechanisms and your self-care system, the mindfulness, so that you're aware when things are showing up in your mind, your body, and your interactions with other people. So it's very layered in that sense.
Mm-hmm. And that's a perfect introduction to the last question I wanted to ask you all before we let you leave, because I will keep going. I will just keep going, because it's such you guys are such a wealth of information, and you're explaining these things where anyone can understand. They don't have to have a clinical background in mental health to understand it. So we really appreciate you making it easy for our community to hear this. So obviously everybody's different in how they handle it, how they manage their stress, their feelings of overwhelmness. And I'm sure you each have different things that you've recommended to those individuals over the course of your practice. But what are some practical strategies or habits that each of you could suggest to help the brain reset and maybe respond more effectively to stress, where we're not hitting that high overwhelming level, where we're preventing it and acknowledging it ahead of time? And I don't know, Dr. Kemp, do you want to start?
Sure. So for one, I always like to take a collaborative approach. I think that self-care, healthy boundaries, things like that is like this umbrella term. And so one, being able to educate, our clients on, or the individual on, what that really means. And then now being able to collaborate on things that are realistic and obtainable for them. So that collaboration piece is important, because we don't want to offer things that are out of their scope, something that they're not interested in. And so I always speak to it as a way of doing something that you feel like is fulfilling to you, so a lot of times we may suggest like exercise, but that may not be what they're interested in, or we may say like take a yoga class, and it's like that's not something that they're interested in. So thinking about things that can be fulfilling for them, and afterwards they feel lighter, or they feel like they poured into themselves after they engage in that activity. And it could be on different levels of, it could be 30 minutes of reading. It doesn't have to be something that's extravagant or like revolutionary. It's like really making sure that it's resonating with them. So I really start there, and then seeing how often they can incorporate those things into their routine, whether it be on a daily basis, every few days, every week, something that's, again, obtainable, measurable. If we can say, you do this after work, take 30 minutes of just like reading your favorite book, and seeing if there's any changes that they're noticing, if they're able to show up better, in their role as possibly being a husband or being a wife or being a mother, and that irritability they're noticing is like decreasing. They're not feeling as stressed or overwhelmed as they're going into those other roles. So again, very collaborative, and making sure, we call it like SMART goals, making sure that it's something that they can obtain, and it's something that they feel like is like resonating and landing with them.
Thank you. Dr. Panna, what tips and strategies do you have?
I think the one that I review the most with my clients is one that helps to stimulate the vagus nerve, which is a nerve that runs from your brain down your spine, that helps to regulate your body in times of really high stress. So I will often recommend that we utilize either temperature, like something really cold, like ice, or something very sour. I recommend to my clients sometimes lemon. So with the temperature, they can hold ice over the sink and hold on to that as much as possible. That can help them to stimulate the vagus nerve so that it starts to shut down the system that makes us, overwhelmed, and help to regulate the system, the nervous system, that will help us to be closer to our baseline. The sour in biting into a lemon, as an example, shocks the system. It shocks our brain, and our brain can't hyper focus on something or brings us back from being shut down through that sour taste, and activates the glands on our tongue that will stimulate chemical responses in our brain that bring us back to the present moment. And then I have them sip on water. So it's a 2-second sip, 2-second swallow. And I encourage that for them because that helps to not only get the digestive enzymes going, which gets us back to our baseline, or closer to our baseline, I should say, but it also helps with stimulating the parts of our body that are, going to allow us to stay closer to our baseline. Plus, it keeps everyone hydrated. So by combining either the ice or the lemon and the sipping of the water, for many of my clients, they've reported that it's helped them to kind of come down from being stressed out and at least maintain themselves enough so that they can pause and pivot to, seeking out help, or grabbing one of their resources, or moving on to something else.
And Dr. Panjwani?
So I use the approaches that Dr. Kemp and Dr. Panna mentioned in terms of collaborative approach, also looking at SMART goals, what's accessible, available, and then also using the senses to allow the clients to be more present with what's going on, because that can immediately help them feel more grounded and regulated. But I also, if I wanted to add something to that, I would say I like a holistic wellness approach. So I'm going to tap into different areas of a person's life, whether that's the body, so the nutrition, the sleep, the movement, whether it's the social life. How are your relationships with your family members, your friends? Are you making time for that? Whether it's meditation, mindfulness practices, is that something that resonates with you? Whether it's journaling, listening to music, whether it's some creative outlet that you enjoy. So really looking at an individualized plan to see what the person's interests are, but also helping them build habits, practice, and consistency around it for it to actually be effective as part of their self-care process.
Amazing. Thank you three so much for taking time. I mean, one thing I know our viewers don't know, in addition to you guys, and you've introduced yourself very well at the beginning, is, I hope they understand, not only are you guys teaching full-time our clinical mental health students, but you're also practitioners, meaning you have a clientele base. So we really appreciate you making time for us in your schedule to come on and share this conversation with our viewers. So thank you all so much.
Thank you.
Thank you.
Thank you.
And if you guys have enjoyed this conversation, we encourage you to like, share, subscribe, and follow, and we'll catch you on the next one.
Thank you for journeying with us today on Keiser Voices, the story of success. As we close this chapter, remember, every story has its next page.